Many of us own pets. Not only do they bring us several physical and mental health benefits, they can also be our best companions in life. Being an animal lover who aspires to be a veterinarian, I always wonder, how is a day working as a vet like? And what are some of the daily challenges does a vet face? And most of all, what does it take to become a vet? So, with these questions in mind, I took up this amazing journey with Toa Payoh Vets during my vacation term to find out more about being a clinical veterinarian. This is a Be Kind to Pet educational video sponsored by Toa Payoh Vets. After a warm introduction to the clinic staffs, I was introduced to my first case. She's a 10-year-old female poodle dog called Kari. At first glance, she seems to be very active and healthy, except for the small pool of urine with blood next to her. I was told by Dr. Singh that she has not been eating for 2 days and has difficulty urinating. Urine in blood could possibly be caused by kidney stones or bladder stones or tumor in the urinary tract, ureter, bladder, prostate, or urethra. This is Kari's second visit to the clinic. She was brought to consult Dr. Singh a month ago and was given antibiotics to treat for infection. Kari's condition improved as the blood disappeared after the treatment. However, it reappeared a month later. The doctor has suggested an X-ray scan for Kari to check for bladder or kidney stone on her first visit. However, the message did not get through, as the owner said he was not informed. And the best solution is to have all advices written down in the medical record. On Kari's second visit, she was first checked for fever and swollen bladder. They were both negative. A blood sample was then taken and sent for analysis to check for bacterial infection. An in-depth physical examination, including a rectal exam and palpation of the urethra, was then carried out to check for tumor. Urinary catheter was inserted to drain out the urine for a clearer view of the bladder on X-ray. The urine sample was also sent for urinalysis to reveal the presence of any crystals. 30 milliliter of air was pumped into the bladder to prepare for the contrast radiography of the bladder for a clearer view. As you can see from this X-ray, the bladder wall is thickened, but there is no tumor on the wall of the bladder. Stones can be seen in Kari's bladder as well as the left kidney. Both could have resulted in blood in her urine. Earlier in the day, I observed a cytotomy, a surgical incision on the urinary bladder to remove bladder stones from a male bulldozer dog. It was the first time I'm observing a surgical procedure on a dog, and it was definitely an exciting and overwhelming experience for me. The dog was put under general anesthesia, and an incision of about 8 cm were made. Another small incision was made on the bladder to retrieve the stones. I was fascinated by the step-by-step surgical procedures, as I can finally appreciate how important it is for a vet to be systematic and meticulous on each task he does. In a small operation room with one vet and his assistant, I stood at a corner and felt the immense amount of focus and steadiness the doctor has with him as he operates on the dog. The operation was a success, and 8 bladder stones were eventually removed. With great admiration and excitement for the success of the operation, I went on to find out more about bladder calculus. When the urine becomes supersaturated, solid can be precipitated out to form crystals. When they are not secreted, they may aggregate into solid, forming bladder stones. There are different types of stones, as shown in this picture. This table shows the comparison of Kari's urine analysis results in May and June. In May, the urine sample analysis shows that there is no crystals in the urine. In June, crystals such as triple phosphate were present, and this indicates that struvite, a type of bladder stone, is present in Kari's body. Hence, no crystals does not necessarily means no bladder stones, and this is one of the common false assumptions made by many pet owners. Although dissolution of some small stones is possible, surgical removal is often needed for larger stones. Dogs consume diet high in carbohydrate are especially prone to bladder stones, which are calcium oxalate. To reduce the formation of calcium oxalate, suggested diet to reduce risk would be dry diets formulated with high protein, calcium, phosphorus, magnesium, and sodium. Kari was on antibiotics, and a special diet was also given to dissolve the bladder stones. She was scheduled to revisit the clinic 7 days later for the cytotomy operation to remove the bladder stone, and she should be fine and active once again. As I was returning home that day during the evening peak hour, in the sudden packed mass rapid transit subway with people returning home from their various workplaces, I realized that it was a perfect learning experience and there were many learning points for me. Not only must a vet be equipped with skills, he also needs to be calm and focused to carry out his tasks efficiently. Miscommunication between the doctor and the pet owner may be inevitable at times. Hence, the doctor also needs good communication skills and patience when delivering these instructions or advices to the client. It really takes a lot of effort to operate and manage a vet clinic. Hence, staying meticulous and systematic are two very important skills a vet should have. Being a student all my life, I can finally appreciate how much it takes to be a working adult, carrying multiple responsibilities at one time and meeting different demands every day. As we are faced with new challenges and problems each day, it is really the passion and dedication that keep us going. This is a Be Kind to Pets educational video sponsored by Vets. Thank you for watching.